Hello and welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News Ask the Expert. Let's take a look.
It has been several decades since a new class of antibiotics hit the market, but findings published in a medical journal in March showcase a breakthrough discovery that could add another antibiotic to the lineup. Only time will tell. Dr. Ryan Paulson, a family medicine physician at Bon Secours St. says antibiotics are key to fighting bacterial infections.
Antibiotics are prescribed when your clinician believes that you would benefit and that there is a high likelihood that an infection is caused by a bacteria, in which case the antibiotic can be helpful to neutralize that infection.
There are several common illnesses that antibiotics are regularly prescribed to treat.
Things such as urinary tract infections, pneumonia if caused by bacteria, sinus infections are a common complaint. Those are general examples when antibiotics may be utilized.
Dr. Paulson says depending on the infection, some people will be prescribed antibiotics for as little as 3 days, others for several months.
Classically, if you are presenting to a physician like me in the outpatient setting, we may anticipate antibiotic durations up to 2 weeks in duration.
Like any medication, there can be side effects.
Common side effects of antibiotics can include GI complaints such as abdominal cramping, diarrhea, but they can become more complicated than that.
Once you start an antibiotic treatment, Dr. Paulson says it's important to complete the entire dose and duration as prescribed. And don't stop it abruptly just because you start to feel better.
Because that could essentially lead to a reemergence of an infection that could have potentially been completely resolved, then also leading to necessity of alternative therapies and down the line. So it is important to complete those antibiotic durations as prescribed.
Antibiotics are not addictive, but overuse can lead to antibiotic resistance, which Dr. Paulson says could be a problem.
A concern for us down the road would be that things that are resolved by certain antibiotics are no longer going to be able to be treated by these, and that's why we have to be very mindful of this.
Dr. Paulson says when talking to your doctor about an antibiotic, make sure they know what other medications you are taking and if you have any allergies before they prescribe one. For this week's Ask the Expert, I'm Taylor Murray. An estimated 1 million people get shingles each year in this country, according to the CDC.
Shingles are a viral infection that causes a painful rash.
Family nurse practitioner Ruthie Craps says shingles is caused by the varicella zoster virus, which causes chickenpox.
So we're exposed to chickenpox, and then once that chickenpox resolves and that initial infection is gone, that rash is gone, we don't shed that virus. It actually stays in our body.
That virus lies dormant, but in some people, it reactivates later. That's shingles. Krabs says 90% of adults 18 and older have had chickenpox, making shingles pretty common, but says it's more often seen in older adults.
Shingles typically is presenting due to some sort of stress or some sort of immune deficiency. So as we age, our immune systems get a little bit weaker, and so it predisposes us to that recurrence or reactivation of the virus.
Shingles is not contagious, but a person infected with shingles can still make someone else sick.
Here's the thing. You have a rash that comes up, right? It's going to be, it has some fluid. When that fluid is touched by somebody else, they can potentially, if they haven't been vaccinated for chickenpox or they've never had chickenpox, they can certainly develop chickenpox, but they wouldn't develop shingles.
Kraps says it's important to take precautions to keep others safe if you have shingles.
If you have shingles, an active rash with fluid-filled blisters, you should really try to keep that covered. And if you do touch it, which you should try not to, if you touch it, you should wash your hands really well to avoid spreading those germs.
Shingles can be incredibly painful. Nurse Kraps says the best way to protect yourself is to get the shingles vaccine.
So if you are 50 and above, you can get the 2-dose series of the shingles vaccine. It's about 97% effective in that age group, and then once you hit 70 years of age, it's about 91% effective.
If you are immunocompromised, your doctor may recommend the shingles vaccine at a younger age. For this week's Ask the Expert, I'm Taylor Murray.
October may be Breast Cancer Awareness Month, but the screenings and care happen year-round.
I think it's most important to just learn your own breast during a physical exam and assess for changes, because that might be the first presentation of a breast cancer.
Dr. Jennifer Cranny has studied breast imaging for more than 2 decades, and in her years of experience, she's seen the time frame fluctuate on when to start screenings. Some health recommendations say you should begin routine mammograms at the age of 50.
A mammogram is an imaging study that uses x-rays to look at the breast tissue with exquisite detail.
But in recent years, that time frame has dropped to women in their 40s and in some cases even younger.
I am seeing younger people, younger women presenting with problems and breast cancers in their 30s. Really, in the last 5 years, this has increased tremendously.
It's not a one-time exam. Doctors recommend you see your physician annually so they can track any changes. You can also stay ahead of the curve by completing at-home screenings. Oftentimes, it's a way to detect breast cancer or other issues earlier.
The best at-home tool is clinical exam. Know your breasts and always look for changes.
Here's what to look for.
So when a woman is doing a self-exam, again, you learn your own breast, and when you might palpate your breasts in the shower or while you're lying down, and most of the time you're looking for a lump or a mass or just an area of thickening, any changes from what you're used to.
If you notice a change, medical professionals say you should talk to your doctor and schedule more in-depth imaging.
It is important to see the mammogram year to year and assess for changes.
Because if you ignore changes in your breast over time, doctors say you could be delaying the detection of a more serious issue. For this week's Ask the Expert, I'm Kelsey O'Donnell. Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Expert section right now. We're going to take a quick break and return with more medical questions and their answers. We welcome you back, and we want to continue now with a look at doctors and health experts answering your questions. This is 7 News' Ask the Expert in partnership with Bon Secours St. Francis. It's no surprise that as our age grows, so does the list of aches and pains.
Most adults will experience an episode of neck pain throughout their life, but the good news is that the majority of cases will resolve on their own.
Orthopedic spine surgeon Dr. James Whaley says there are a number of reasons for neck pain and stiffness, including poor posture, arthritis, muscle and ligament issues, or injury. However, he says most can be treated with anti-inflammatories or a specialized stretching program.
These are usually self-limited, meaning that they'll get better with time. However, some people may require treatment that involves physical therapy or even injection therapy.
Doctors say more serious cases could require surgery and have a lasting impact on your lifestyle, which is why experts say you shouldn't ignore how you're feeling.
If you have symptoms such as numbness or tingling in your arms or legs,
he says those symptoms could be a sign of a more severe problem. Dr. Whaley says it's also important to seek help immediately if you're in an accident.
you should seek medical attention or go see your doctor anytime you're involved in a traumatic event that causes neck pain, whether that be a diving accident, a sports accident, if you fall, or if you're in an automobile accident.
Severe headaches and a fever accompanying neck pain are also reasons to see a doctor. For this week's Ask the Expert, I'm Kelsey O'Donnell. It's part of the structure and support of our bodies. Doctors say the spine impacts how we sit, stand, walk, and bend, which is why proper health is vital.
It can be kind of an intimidating topic, an intimidating part of the body for patients to come in.
Dr. Ben Ramsey is an orthopedic surgeon at Bon Secours who helps patients with spine issues.
The nice thing about spine is it kind of covers all gambits. There's sports, there's trauma, there's infection, there's deformity, there's degenerative conditions. I would say the majority of what we treat is degenerative conditions of the spine.
There are a variety of causes and conditions that impact the spine. Doctors say the impact is more common than most realize.
Hip replacements, knee replacements, or shoulder replacements are very popular these days with an aging population, but the same arthritis that is present in those joints is also present in the back.
As far as when to see a doctor, that varies. Health experts say any pain in your neck or back is a sign to seek medical attention.
The more indicated reasons to see us are any pain that radiates from your neck or your back into one of your extremities, whether it be your arms or your legs. Also, any issues with balance or coordination, walking, doing fine motor tasks like buttoning buttons or handwriting. Those can all be potential signs of problems in the spine.
Doctors say help comes in different forms, ranging from physical therapy to, in more severe cases, surgery.
One of the first things we start with is physical therapy, anti-inflammatory medications, as long as those are indicated for that patient and their medical history. And then we kind of start to build a relationship and decide whether or not surgery is something that may benefit them in the future.
While some conditions are unavoidable, to improve your spine health, doctors recommend being cognizant of your posture and other day-to-day decisions.
Whether it's posture when looking at your phone, or the height of your workspace at work, or the types of activities you do may not affect you in the short term, but over time they can add up.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
The better you sleep, the better your overall health.
Kristen White has been a doctor of physical therapy for half a decade, helping patients better their sleep posture.
Sleeping posture is super important because if you're trying to sleep in a position that's uncomfortable or that can cause pain, it can impede your rest. And we all know that sleep is very important for healing and for energy levels and for our daily life.
Doctors say there are a number of factors that can lead to an uncomfortable wake-up call, including the position you rest.
The main goal with sleeping is that your spine is in a neutral position, a position that doesn't put strain on certain muscles or on certain joints.
According to health experts, the strain is often the outcome of contorting your body into various positions or caused by improper support. Doctors recommend using pillows to bolster your neck, back, and knees.
You want to make sure that you pull the pillows up as far as they'll go. So Jessica, if you grab the tail ends of those pillows and just pull them all the way up, and then rest your knees like this. What this accomplishes is it flattens her lumbar spine. It decreases the arch in her back, so that helps there not be any stress on her lumbar spine.
White says lying on your back or your side are two of the best options. However, there is a third popular sleeping position she's not thrilled with.
It's very difficult to keep your neck in neutral alignment when you're on your stomach. Typically, the head will rotate left or right. This is going to put a lot of strain on one side of her neck. So this is one reason I don't recommend lying on the stomach.
Sleep specialists say choosing proper pillows and a mattress that is right for you can also help. As for where to start, doctors say somewhere between soft and firm. That's a decision left up to you and your comfort level. For this week's Ask the Expert, I'm Kelsey O'Donnell.
Don't forget to submit a health topic for our Ask the Expert series. Go over to our website, click the news tab, and look for Ask the Expert. More of your questions are going to be answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert.
Colon cancer will affect 1 in 24 men and 1 in 26 women in their lifetime, according to the American Cancer Society, which is why doctors are stressing the importance of awareness.
Colorectal cancer is a abnormal growth that happens in the colon or the rectum. So rectum is the last part of the colon, and the rest of the colon is the large intestine. So it's an abnormal growth that happens in the large intestine.
Medical Director of Gastroenterology at Bon Secours, Dr. Viral Oza, works directly with patients who have developed abnormalities and in worst cases are living with colon cancer.
Having a cancer does not necessarily mean you'll end up with surgery. It oftentimes does, but there are some cases where you might be able to avoid surgery.
That's where early detection is important. Doctors say survival rates are significantly higher when it's caught early.
Sometimes people get a screening colonoscopy done and are completely asymptomatic, and we find it early colon cancer. Other times people have symptoms such as change in their stool caliber, where you can have very thin stool, or even rectal bleeding.
Dr. Ryan Bush says routine checkups and colonoscopies should begin at the age of 45, even earlier if you have a family history.
Colon cancer can be prevented by early detection, and that's our goal with colonoscopy starting at age 45. Is if you come in and get your first colonoscopy and we find a few of these precancerous polyps, we remove them, and ideally reducing the rate of those polyps turning into colon cancer.
This year alone, health experts from the American Cancer Society estimate colon cancer will be the cause for more than 50,000 deaths. But doctors say you can avoid becoming part of that statistic with proper screenings and by practicing living a healthy lifestyle.
Smoking, you quit smoking if you are smoking, or don't start smoking. That includes tobacco. It includes dipping. Here in the South, I've noticed there's a lot of dipping amongst patients. So that all does increase risk of colon cancer. Colon cancer is preventable, and what I mean by that is being focused on your diet. Exercising, having an active lifestyle has now been shown to reduce rates of colon cancer in the long run.
For this week's Ask the Expert, I'm Kelsey O'Donnell. According to the American Cancer Society, there are more than 100 types of cancers, and doctors say the ages of those being diagnosed is changing.
Anybody can get cancer. It's more common as we get older because part of getting older is the DNA starts to become less stable as it divides.
Traditionally, Dr. Kevin Kohler says he sees more cancer patients in older generations, but in more recent years, those coming in for treatment are younger.
We're seeing more and more younger people being diagnosed with aggressive cancers that weren't necessarily observed, in a couple generations before. We're assuming that a lot of that has to do with our diets.
Improper diet and unhealthy lifestyles, Kohler says, are having a negative impact on many people.
It's your environment. So it's your diet, it's how do you move physically. Like we know that sedentary lifestyle, obesity, both of those also play a role with developing cancers, specific types of cancers even. So it always comes back to the same simple advice of eat a healthy diet and move, and that's just difficult to execute in our modern lifestyles.
But thanks to advancements in technology and improved screening methods, early detection is playing a key role in helping doctors identify and treat cancer earlier.
In the last 15 years, 20 years, we've made a lot of progress in targeted therapies, so having therapies that are specific to a mutation that may be present in the cancer, and then also immunotherapies, which are non-chemotherapies.
Doctors say the type of treatment and screening you may receive can be based on factors like age and gender.
I would say there's some routine screening guidelines for most people as we kind of cross certain thresholds of age. So for example, women getting mammograms at age 40 if they're average risk. That changes if you have a family history of breast cancer, where then you might go say age 30 or 35.
For many, the thought of having cancer can be overwhelming, but taking proactive steps to prioritize your health can make a big difference. Not everyone requires an oncologist right away, so consulting with your primary care doctors can be a good first step, especially if you have a family history of cancer.
I think the main thing is that just people, they're aware of their own family history and that they're transparent with that with their family physician, that they're getting the regular screenings. Because again, there's only a handful of cancers that we can actually screen for, and that those screenings do save lives. That's why they're there for us.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
1 in 2 people will be diagnosed with some form of cancer in their lifetime.
With 20-plus years of experience in the medical field, Dana Laird says cancer research has evolved through the years with troubling trends.
It's the leading cause of death worldwide.
According to the American Cancer Society, the past 3 decades have shown a steady decline in cancer-related deaths. However, the number of people diagnosed is trending up.
It's not just the older crowd either. I mean, we're seeing 30-year-olds coming in with metastatic cancers.
Health experts say the diagnoses are due in part to advancements in medical technology, many of which aid in early detection.
Some cancers can be curable or put into remission if it's caught early enough. If people sit on signs or don't seek treatment for some warning signs, it can progress and spread.
The key, doctors say, is catching cancer in its early stages, and in many cases, symptoms are ignored or even go unnoticed.
It depends on the type of cancer, but things people need to look for are any unusual lumps or bumps on their body that don't typically belong there, any skin changes or unusual rashes, unexplained bleeding from your gums, dark, tarry black stools, unexplained fevers, night sweats, unexplained weight loss. There's a lot of signs of cancer out there.
With more than 100 types of cancer, health experts say symptoms can vary, which is why it's important to stay on top of your health. The earlier you know, the quicker you can begin treatment, which could increase your chance of making a full recovery.
Treatment is determined by what type of cancer you have and what stage it is. Certain treatments may just be surgery to remove the cancer. Other treatments may include chemotherapy, immunotherapy, or even radiation. I highly recommend to people that if you notice something unusual that should not be there, like I said, unexplained bleeding, bruising, anything abnormal, the best thing to do is go to a doctor to be seen and get checked out, because if you don't, you just ignore it. It's a decision between life and death.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
That's a look at this week's Ask the Expert show here on WSPA Plus. Be sure to join us every Thursday on 7 News as we seek those answers to your top health questions, and each week right here on WSPA Plus. For now, thanks for making an appointment with us.